right? All right, guys, so I'm going to talk about flattening the curve, what that means. First, it's important to understand what is the curve. So I've got the graph up behind me if you guys can see. We're going to first talk about the red portion, which is the curve, and then we're going to talk about the blue portion down here, which is how and we can flatten it and what that really means. So in a graph, you've got two axes, right? The y-axis represents the number of new cases, and new cases is really an important distinction from a public health perspective, and the x-axis represents over time. So how many new cases are we getting over time, right? So as you see in the red bell curve, it's a lot of new cases in a very short amount of time, right? Another really important thing about the curve is that line right there going across the middle of the curve, right? That represents the threshold, which is the capacity of a healthcare system to handle all of these new cases, all those red new cases, right? Now, whether or not we're in a crisis or an epidemic or a pandemic, there's always a threshold. There's always a certain capacity that a healthcare system has to handle cases, right? It doesn't matter if it's a normal time or it's a crisis or panic mode time. However, during the time of an outbreak, such as now, when the number of cases here exceeds that capacity, exceeds the ability of a healthcare system to handle, what happens is we see their resources stretching thin. So what does that mean? So staffing, such as doctors and nurses, there's not enough to take care of the number of new cases that are coming in. Equipment, machines, medications, right? And that can mean PPE, that's personal protective equipment, that's masks to protect yourself, equipment that can mean ventilators, medications. You know, there's a lot of trials right now to see what's going to work, what's not going to work. Not enough data for me to share that with you just yet. But basically, you know, the resources are stretched thin when there's such a high number of new cases in a short amount of time, and it exceeds that capacity, that threshold, right? And then unwillingly, something really horrific has to happen, and that's triage, right? So what does that mean? So that means, let's say 100 people show up at the emergency room symptomatic and needing help and care. Someone, a healthcare professional, has to decide, okay, we're going to take care of patient A and B, and we're going to selectively and willingly not take care of patient C and D. Because we have such limited resources, we think that patient A and B has a higher chance of survival. So let's focus our resources, time, and attention on saving these lives. You're basically deprioritizing patient C and D because they have a less chance of survival. Nobody wants to do that. It's horrific. Unfortunately, we are seeing that happening in certain parts of the country, namely New York City, where the death toll is just rising and the number of new cases are just increasing at an exponential rate, which is typically what we would see in a viral outbreak anyways. So the point is, what is the point of all this? The point is to reduce the number of new cases, to bring it below the threshold line so that those who do get sick can be managed and treated and taken care of, right? Now, twofold here. Yes, we want to reduce the number of new cases, and yes, we also want to increase this threshold line to increase the capacitative power of a healthcare system. But again, when something happens so rapidly, it's sometimes really hard to do. And my screen just shut off, so sorry about that. But we want to, namely, reduce the number of new cases. And how are we doing that? So all the movements that you see with the social distancing, washing your hands, coughing into your elbows, isolation, quarantine, why are we doing all this? We're doing all this as a population to reduce those number of new cases. Essentially, these preventive measures are meant to just reduce the transmission of a viral infection, and they're not specific to COVID-19. It's actually if this were another viral strain, another viral outbreak, these would be the same measures that are recommended. So I hope now that you understand why it's so important to do all these things. We need to reduce the number of cases because it's increasing at an exponential rate that is exceeding the capacity of our healthcare systems. Things that we can do as a population is just to stay at home, try to prevent the spread, try to prevent those new cases. That way we're not spreading it and making the situation worse than it already is. That way we don't have to make these tough decisions of triaging of who to save and who not to save, right guys? So I hope we all do our part. It's really important. I think it's a social responsibility that we all have to flatten that curve, to bring down those number of new cases below the threshold, and again, just to reduce the number of cases over time. So I hope that was helpful. If I've made any mistakes, definitely correct me and let me know. If you guys have any further questions or if I wasn't clear, please ask. I'd love to explain further and help out in any way I can. All right, guys, take it easy. Take care. Stay positive.